over half the deaths could be prevented. And I also think they don't understand it is not expensive to address this, that there are low-cost solutions using technology and virtual care coordinators and health navigators and the types of things we do that can really move the needle. Using technology and being connected to these clinicians and creating an experience that is like a ChatGPT, but from my doctor, is really what we are hoping to create as an industry and part of what we're thinking about at Wildflower.
What is the biggest misconception about maternal mortality in the U.S. that healthcare leaders still don't fully understand?
I think people don't fully understand that a lot of it is preventable. I mentioned over half the deaths could be prevented. And I also think they don't understand that it is not expensive to address this, that there are low-cost solutions using technology and virtual care coordinators and health navigators and the types of things we do that can really move the needle. And so I think that is the biggest misconception.
That's amazing. That's good news.
Should be.
Well, because you have a solution for it. Mm-hmm. Wildflower. We're seeing a growing shortage of OB-GYNs and nurses. When the system has fewer clinicians but a higher risk, where does Wildflower actually step in and close that gap?
It's a really important question. It is, we have a growing shortage of clinicians, and what we really aspire to do at Wildflower is to make those clinicians most focused on patient care in the most robust way they can and getting things off their plate that they don't need to be doing. So the example of we'll coordinate all of the things that you don't need to do in your office. The example of we take routine questions, right? We have OB-GYNs and midwives who spend 5 or 6 hours a week just answering questions on email, which is incredible service to their patients. But we can use technology, AI, validated content, non-clinical personnel to answer whether you can eat sushi or not. And that really helps take a load so that those clinicians do the things that only they can do, which is a lot and is really important to preserve.
That's incredible. That makes so much sense to have that kind of support. There's so many things that you don't know. Would you know nothing about it? Mm-hmm. So how would, if you've never done it, or you don't have a sibling, or even if you have different, symptoms than somebody else, like, from what I've learned from speaking with physicians, ChatGPT isn't the most reliable source for determining your next steps at this stage of the process when you're pregnant.
Yeah, at this stage, but it's what the consumers expect, and they want instant answers. So how do we enable the healthcare system to be that credible source of trust, but meet that consumer desire to know right away what I can do? And that's where using technology and being connected to these clinicians and creating an experience that is like a ChatGPT, but from my doctor, is really what we are, I think, hoping to create as an industry and part of what we're thinking about at Wildflower.
And it sounds like what you're already doing. I mean, what I mean is that this is the perfect alternative. It's immediate, it's customized, and it's people that are educated in this specific area, which is very different than just a random chat that you don't know what context, they don't have context for your health, and these people have so much more context. Right. And the weight and the strain of the schedule for a physician to try to address everyone's, like, any question that they have would be just too much of a strain on their day. And what problems must remain human?
Well, obviously, we need real people to, like I said, to deliver babies. I think there is what I hope from technology and from AI.
Depends on who you ask.
What?
Depends on who you ask. Some people think in 3 years that's not a thing, and you think that will always be a thing.
That a human will deliver a baby?
That you won't need humans to deliver a baby in 3 years.
I don't believe that you will want to deliver a baby without a human there.
Yeah. Sounds really good to me to have a human there.
I think it's really good. Yeah. It doesn't always need to be a doctor. Nurse midwives do great delivery. And so there are, but my hope is that technology will actually increase the human connection as opposed to taking it away. Maybe I'm old-fashioned, but I really believe that part of health and buoying someone's how they feel, especially in something like pregnancy where you already feel so vulnerable, or anytime you're in the healthcare system, you feel vulnerable. I think it's going to be hard to really replace a trusted human connection. And ideally, those clinical providers and all the ancillary staff are better able to provide that because technology is taking away stuff that they don't have to do. Right. So, that to me is where I hope we end up.
I love that. I love that for us.